Meanwhile, it has been almost 6 months since South Africa launched its COVID-19 vaccination program. To date, more than 23 million people have received at least one dose, and close to 13 million people are fully vaccinated. But the fourth wave is expected to hit the country next month, and as expected, as experts have stated, its severity will likely depend on whether the country achieves its vaccination targets. Higher Health held a discussion today to predict a number of scenarios for the upcoming wave and variables that can make a difference, particularly in the higher education next year. Here to talk to me about this, we're joined now by Higher Health CEO, Professor Ramneek Ahluwalia. Prof, good evening, and thank you very much for your time. Firstly, is it inevitable that we are going to see a fourth wave of infections in South Africa? What are the factors that are informing that, and how is it possibly going to play out as far as the various scenarios that we can look at?
Well, thank you very much, and good evening to everyone. If you would have posed this question last year at the same time, we were still kind of discovering this virus that was new to human mankind. But I think science has grown tremendously. We've been able to crack this virus. We have been able to crack the genomic sequencing of this virus. We understand how it mutates, how it moves around. So I think now we are in a situation where we can start predicting what the future will look like, what the next months will look like, what the next few weeks will look like. And I think that's where it starts being better for us to now start planning business continuity, academic years, and an economic sense of life going forward. So the South African Modeling Consortium in National Institute of Communicable Diseases did a lot of modeling work that helps us understand this virus predictability going forward. And there are about 3 key variables that we are looking into, which will decide our fate of this inevitable so-called fourth wave. The first one is the behavior of us as humans. To be very honest, we're entering into a festive season. People are going to mingle, crowds are going to assemble together, social distancing will go away, masks will go away, and that's exactly what this virus loves. The virus likes to move from one human to the other as quickly as possible so that it keeps moving to find a body, sit together, and mutate to a way it's of its liking, and it becomes highly transmissible and has more replication powers in our human body. Now, the second big variable that will define our fate, and this is all modeling that will keep these variables together to predict the fourth wave, and the second one will be the mutations. The inevitable reality is that this virus mutates. We've seen it. The first wave was through the original coronavirus that existed into human mankind. The second wave in South Africa was caused by a variant of concern called Beta, which we first found in South Africa and caused a havoc for us. And then suddenly a Delta variant came, which was found in India and came to South Africa. And when it came, it caused us a major third wave, which we just come out a month back. So the virus is mutating, and what we are predicting is how does the mutations happen? The one thing we are sure, the virus will mutate so that it can replicate faster, the viral load will be higher so that we can transmit more, and obviously it overpowers our own immunity. Yeah. The second thing we will be watching in the new variants is how much escape mutations will be there, which means can it break the vaccine immunity? Can it break the natural immunity of humans? And that mutations will be extremely watchful. What we've seen with the Delta variant is in England, in the United Kingdom specifically, and other parts of the world, not in South Africa yet, is the sequencing of the same Delta variant where it's called a Delta plus, where it is 10 times more transmissible already from its current form. So this is what we are looking into, what this mutation will look like and what will be a variant of concern that will cause us the fourth wave.
Right. Before we get to the possible solutions, particularly when it comes to the variant of concern, I want to take you back a little bit on the individual risk reduction behavior and how much of the behavior, at least in the past month with the local government elections, the campaigning of the political parties, and so on and so forth, how much damage has that done in our behavior and in people thinking that, well, look, we can actually leave the masks at home and we don't need to be as vigilant when it comes to the other protocols that were in place?
So, when the South Africa has estimated from our new work is that 60 to 70% of South Africans have already got COVID-19. Some were very symptomatic, some died because of it, some were in the ICUs, but many were non-diagnosed but had asymptomatic infection. What does that imply is that humans in South Africa got an immunity automatically to the COVID virus, which is protective already because you already have. Now you've already indicated 23 million South Africans have been given at least the first dose and 13 million South Africans have been fully vaccinated, which means that boosting immunity is already in this population already. So when the third wave, which is the Delta variant, which was causing a havoc, or the Beta variant that caused a havoc 6 months back to us, created that immunity among the South African humans so far that even during this whole political scenario, the crowd mixing, the mask going, as much as the virus kept moving from one place to the other, it could not be able to cause the severity of a disease, hospitalization or ICU admission, and that's why the third wave came to a down, because our own immune system overcome. But does that not mean that the virus is not moving? The virus is still enjoying the freedom, which means it's still finding a body in South Africa which it can sit and mutate. And the wait is which this new mutation, the new variant of concern, will arise suddenly, like the way it happened last year, similar time in November, December, when the Beta variant came to South African origin to such an extent that it caused a huge Christmas havoc for us, and then whole mingling and whole social behavior change killed the whole nation into a huge second wave. And we saw so many people dying and so many people debilitated in hospitalization or ICUs. And that's what is the worry for this crowd. And that's the worry that we have as scientists to consider what this political battle or this election campaigns, or now when the behavior has moved down and people are living a lockdown one relaxed life, that they are still allowing this virus to mutate and move freely because we are not wearing the mask and we are not keeping a distance. Because this thing and this disease is an airborne, it is through aerosols and it moves in the air very quickly in close transmission from one human to the other.
Yeah. Now, the percentage of the population that is protected by vaccine, how far will that go? I mean, the United States already showing infections of about 95,000 a day. And one of the experts there, or the scientists, saying that if you took, for example, the Johnson & Johnson jab 6 months ago, you're not protected now. If you've taken the 2 jabs of Pfizer, you certainly need a booster jab to be fully protected. Where do you sit on that?
So absolutely true that what we are now seeing after 6 months of vaccination program in South Africa and across the world is that in 6 months' time, the immunity of the vaccine starts waning down a little bit. There is no doubt about it. And that's natural because that's going to happen. So is the natural immunity when you get a COVID, it does start waning down. But one thing we are 100% certain from what the US data, the Israel data, or the UK data is giving us is very clear that even though the infections are 95,000 a day, but the number of deaths and hospitalization is still minimal, despite having the vaccine more than 6 to 8 months. So yes, in the 6 months down, your chances of getting the infection is high. I mean, you can get a breakthrough infection, but the severity of that infection is going to be mild to a moderate one, which means few flu-like symptoms, you are going to be prone to the infection. But what is still going to prevent, and what we're still seeing so far, is the vaccine is still extremely effective in not letting you go to the hospital and deaths. And that's exactly what we're seeing in the United Kingdom, we're seeing in the United States. So what we're seeing from whether it's a J&J vaccine or a Pfizer, yes, the immunity in 6 months' time slowly start going down. It will cause you infection. It can go to a breakthrough infections to you, but it will not lead still to hospitalizations and the severity of the disease because that kind of immunity still exists. What we're going to be watching is in how long will that also be further decreasing in the waning part. Can the decreasing of the waning in the next 2-3 months go so low that the breakthrough infection and the viral load and the new mutations will overpower the body that we'll be admitted in the hospitals or we'll be in the ICUs and deaths will happen again, that's a wait and watch. But so far. So the inevitable reality is fourth wave is going to happen in South Africa too. And it will cause a lot of infections. But if we have vaccinated our population, if we have found those behavioral changes into us, what we will limit is infections will be there, no deaths, no hospitalizations, and that's what we want to be achieving as a country to start living with COVID-19 like the other parts of the world. And then boosters will eventually have to be put into place with time when to even avoid the breakthrough infections, because they will eventually boost our immunities to another level and adapt to the new variants that will be coming so that even the breakthrough infections don't happen. But vaccines so far, despite 8 months and 9 months of data, is clearly showing severity of the disease and hospitalization is still very protected.
Now, with all that, Prof, where does that then put us in our endeavor for safer campuses, particularly going into 2022?
So definitely from all the predictability scenarios, and we can be wrong. Viruses are very clever, and as much as our human brain tries to crack this invisible organism, the invisible organism can play smarter. So there's nothing 100%. But one thing is for sure, what we are seeing from the predictability of our fourth wave, that's not going to be as lethal as it was the third or the second wave, or specifically the third wave. We do anticipate that infections will be there. We will anticipate certain deaths still inevitably due to the number of transmissibility, and it will all depend on those factors that I've spoken about, number of vaccination of the people versus the new variant. But still, the way we have already vaccinated our population, the way our population is responding, and the way we have seen the natural immunity in our human bodies already, because of 70% of South Africans having COVID-19, clearly predicts that the wave will not be lethal, which means the maximum we will eventually see can be a lockdown 3 if the president moves into us, but not a lockdown 5, because the hospitals will not still be overcrowded. We might not have the ICUs that full, which will allow freedom for people to continue business continuity, which predicts our campuses for contact learning, which is the most important information, because we can't be building skills online. It's practically impossible. You can't build the whole economic skills, the graduate competency sitting at home. So universities, colleges, skills development programs are built on contact learning perspective. So which is the good news is that we predict 2022 for a hybrid model, but 70% now more into contact learning and 30% into online learning, versus this year where we were 30% contact learning and 70% online learning, which is a great information, a great answer, the solution for our young generation, for their mental health, their success in graduate, our development goals, and our skills building process. And that's where we are moving into.
Professor, appreciate your time. Thank you very much for joining us. Higher Health CEO, Professor Ramneek Ahluwalia there, explaining, of course, the outcomes of their deliberations as Higher Health that took place today.